Hey everyone! So as I'm sitting here, I'm realizing that one, I need to find a new place to do these videos in my new apartment because all of the lighting seems to be horrible, and like this one has no background on it because I haven't hung my pictures yet, but all that in due time. The point of this video, so this video is going to be really exciting for you guys, I hope at least. I will try and make it as exciting as possible. But first of all, I'm going to do just kind of like an update. It's been, I think, 2 weeks since I was last on making an actual video. I've been responding to comments as quickly as I can when they come in. So I'm going to do a quick update. And then afterwards, I'm going to give you guys my top 10 must-haves for nursing once you're out of nursing school. But I mean, some of these can be used for nursing school as well, and I think some of them were in a video I did a couple years back now. Actually, I think it's been almost 2 years now that I did when I was just starting nursing school, and I had my clinical bag and some of the things that I thought were super important to have for clinicals. So check that video out. I'll leave a link in the description below to that video. But this video is going to be a quick update, and then we'll go into my top 10 must-haves for nursing. Let me grab this real quick because it's kind of important. So, it's got my list to make sure I hit everything on it. So anyhow, the last 2 weeks have been super crazy. I've been on my own now. I think I mentioned that to you guys before. Just getting into the groove of how everything goes, how I want to schedule my days and stuff like that. But it's been, I think this week is 2 months that I've been on my own. So it's really exciting. It's awesome to be able to be in this field and be able to finally putting into practice and feeling competent and confident in myself. I worked one day this last weekend, and then I work 4 this week because I picked up a shift. Our hospital is critically low, especially on our floor, and so they've done this thing that for every shift you pick up, you get an extra $75. Plus, because I work night shift, I get night shift differential still. I get this extra $75 the shift, and I get whatever overtime if it's my 4th shift. So this will be my first shift that I've picked up. We'll see how it goes. I know I'm not going to be picking up a lot right now, at least. In nursing school, they always told us, at least, that you don't want to, they called it flopping meat. You don't want to become flopping meat. So you don't want to get into this to where you're running yourself down, you're tiring yourself out, and you're just, at the end of the shift, you're just like, I cannot, take this anymore. You end up wanting to quit and all that. They don't want you to get run down. So they recommended that we did not work any extra overtime for a year. And that makes sense, but I know for me, I just bought a new phone because I had to, and moving in, I'll make $500 in my working this overnight shift, which will help in just paying for my phone alone. So because I wasn't expecting that payment, I decided to go ahead and pick up one shift and just see how it goes. I only committed to one, and I told him, I was like, I probably won't be picking up much more. I want to get comfortable first. So we'll see how it goes. Probably not something that I'll be making a habit of, and not something that I don't think I would recommend, because even now I feel like after working 3 days a week that I just feel exhausted by the end of the 3rd day, especially working night shift, because your schedule is so back and forth, and it's changing, and it's exhausting. It really is. I don't know any other word for it. So not much has been going on as far as work-wise. Starting to look into some schools for my bachelor's degree. I'll keep you guys posted on that. I am let's see, I work 4 days this week. I haven't so far had any bad patients. I've had several that have constantly been asking for pain meds, and so that was an experience last week. I'm trying to think of things to talk about for that, but like last week, I had 6 patients. Most times 6 is their allotment, but we were so short-staffed. We had 4 nurses working, plus our charge nurse. All of us, including the charge nurse, had 6 patients, which the charge nurse, they have their own responsibilities. They have a list of things a mile long that they're supposed to do on their shift. So the fact that she even had 6 patients, like, that just tells you, first of all, how short we are, how short-staffed the hospital was that night because no one could float to our floor to help out. And, it was crazy. It was so busy. First of all, a charge nurse should never have 6 patients on top of her responsibilities. She didn't end up leaving until noon the next day because she was focused on her patient all through the night, so she didn't even do her, charge nurse responsibilities until after she was, done with that. She was still doing midnight and 4 o'clock, assessments and charting and stuff like that at 8, and when I left finally that night. And I went and I asked her, is there anything I can do? And I did a couple things for her, that were part of her charge nurse role that, she could delegate. So I did that for her before I went home, and I left about 8. And that was kind of late, but that, again, we were super busy. That night, out of my 6 patients, 5 of them kept asking for pain meds, and they had, pain med and then breakthrough pain med that was scheduled by the doctor. And it just, I don't know, I guess it was how it worked with those patients. But it seemed like every patient, I'd go into this patient's room and they'd ask for pain meds, so I'd give them. I did not finish too, and this is really bad. I was frustrated at the end of the night, but looking back, my charge nurse, I don't think she realized how amazing these words meant to me at the time, but she told me that I was doing such a great job. She was so impressed with, how well I was doing. She's like, there's another girl who is working here. She's like, I'm not going to mention any names, but she's new also. She's been here for 6 months now, though. 4 months now, 4 to 6, somewhere in there. And she still, doesn't have things down. She's not getting things, which is fine, but she's like, you just have been such a big help tonight, and tonight was so rough. I'm really proud of how you handled it and everything. But I did not finish my 10 o'clock med pass until I think it was 12:05 when I finished. I'm pretty sure it was 12:05 because I remember it being after midnight. But usually when you're giving meds, you have that hour before, hour after to give meds, and that didn't happen. I tried, but I was in a patient's room, and I had another patient who called me and was like, I need my pain meds. And so I told him, I said, okay, I'm finishing in this patient's room, and then I'll be right there. And they called me 2 other times while I'm still in that patient's room. So I finished giving those 8 o'clock or 10 o'clock pain meds. I went and gave their medications, gave the pain meds to that patient. Another patient's calling me, I'm in pain. I was like, okay, well, I'll be right in, and I'm going to give you your pain meds and your other meds. So I had my other meds pulled up, so I went and pulled their pain meds and gave it to them. While I'm in, and by the time I finished giving pain meds at 12 o'clock, that first patient that I had dealt with, they were calling again, asking for their breakthrough pain med, and it was, on the dot. I felt like a druggie. I could have started a collection with the number of Dilaudid vials I, broke, glass vials I broke, because they come in, yeah. Anyhow, I must have broken, 15 of those vials, and it was crazy. I never sat down that night. I never got lunch. So it wasn't like I was taking time out for myself to do other things. I was constantly busy. I was constantly in a patient's room, talking with a patient, calling the doctor about patients. It was just crazy. And so, changed shift report at 7. I did all my charting, finished up, caught up on everything, went and asked my charge nurse if she needed help, and did a couple things for her, and then I went home that night. Thankfully, that was my last night there of 3. But, I mean, you have to understand the patient is in pain, and pain is what the patient perceives it as. You can't say they are or not. I don't like to say that they're pain seekers, although one of my patients that night, her actual admitting diagnosis was drug abuse, and why they scheduled her for Dilaudid, I'm not quite sure, but the doctor said go ahead and give her. I was only giving her 0.5 milligram every 2 hours, so you would think that, I don't know. But anyhow, so got off topic there. But anyhow, you can't describe what the patient's pain is. You can't say that they are or are not. That's not your position. I don't know where they're at. I don't know what their history is. I don't want to ever be in that position where I'm in pain and I'm in serious pain and I'm asking for pain meds and someone else thinks that same thing of me. So I try to not label patients as pain seekers, but I definitely was giving pain meds all night because my patients were in pain, and I tried therapeutic techniques. I tried imagery. I tried turning this one girl, she had a smartphone, she didn't know how to work it, so I found this YouTube station and was playing beach music, noises for her to try and help between breakthrough pain. I mean, I exhausted all my things, and at the end of the day, I just felt I kind of felt hopeless in a sense. I'd been doing all this stuff, and here I was helpless, but I felt like I hadn't done anything to better my patients, really. All I had done all night, I felt was pain meds. I hadn't, been able to do anything. My one patient who wasn't a pain med should have been. She was going for open heart surgery the next morning at 5 o'clock on my shift. So I, amidst giving pain meds, I had to, fill out her consent forms with her, make sure she got a chlorhexidine shower, made sure her IV was working all night. I braided her hair at one point because it just helped keep it out of the way when they were doing the procedure. Another nurse had told me if you get time, so I was well, I'm not gonna get time, but I'm gonna make time. So I was taking care of that stuff too. So I was busy all night, and I didn't feel other than her, that I'd honestly done anything for the patients that was worthwhile other than give pain meds. So hearing my charge nurse at the end of the night saying, I'm proud of you. I'm so proud of how far you've come. You're doing a great job. Keep it up. That was just, as I was driving home, I was thinking about it, feeling that, and frustrated. But honestly, there wasn't anything else I could have done. I was calling the doctors trying to see for a couple of them if I could, fix how their pain meds were scheduled so that they weren't in so much pain. But there's only so much that I could have done that night anyhow. And part of that was because we were so short-staffed. That was beyond my control. So I picked up this one night because I know right now on the schedule there's only 3 nurses scheduled to work. So now with me there's 4 nurses plus the charge nurse. And we technically are needing 2 more nurses to be fully staffed that night. But we're a 39 bed floor. So that's still, if we are at full capacity, that's still a lot of patients for one nurse to be handling. And thankfully, my charge nurse that night that I worked, when we were so short-staffed and she had 6 patients, put her foot down because emergency kept calling us to send a patient up, and finally my charge nurse was listen, if you're sending a patient up, you need to send another nurse up to take care of them too. She's we are at full capacity here. Everyone, even myself, has 6 patients. I am not going to give one of my nurses a 7th patient. She's first of all, staffing-wise, the hospital doesn't really condone that we work at. And she's second of all, that's not safe for either the nurse or the patient. She's so if you're going to send somebody, you need to send a nurse as well. So we ended up not getting any admits that night, which is a blessing because I wouldn't have been able to take another one. I would have had to say, put my foot down and say no because I was already so overwhelmed and I felt so behind, even though I really wasn't that far behind. But with everyone keep asking me, things just kept piling up. So she's super sweet, super thankful for her, and that she stood up for her guns. And that's something else to point out. I know this is getting longer and longer now, but I feel it's good information, right? It's helpful, yay or nay. If so, you can just fast forward until I get to the next minute when I talk about this stuff. But anyhow, I feel like it's super important to realize that you have the ability to talk with your charge nurse, build that relationship and be like, listen, I'm super overwhelmed. Is there any way, like, if I get this new admit that someone, like another nurse, could help me out? Especially, one, if you're a new nurse, but even as a seasoned nurse, I think that you have that right to ask and be like, is there anyone that, yes, I will take over this patient, but would anyone be willing to do their admission assessment? Would anyone be willing to go in there and at least greet them, since I can't get in there right away necessarily? Something like that to help you out. Maybe, okay, I'll take that next patient. I'll go in and do their admission assessment and I'll do this, but would you mind, having somebody else go and do this for this person, or get this person off the bedpan, or make sure this person gets their Clorox, something like that, so that you're working as a team and not feeling completely overwhelmed. But definitely in that situation, I am glad that Janie said, no, I'm not giving another nurse 7 patients. Like, that's not happening. So that night was rough, really. I mean, and I don't have anything other to say for those 2 weeks, but we'll see what this week with working 4 shifts leads to, so hopefully it's not too bad, but we'll see. So, all right, now to the fun part that you all, I'm sure, are most excited about is what I think are the top 10 must-haves for either a new nurse or a nurse wherever, working on any floor or unit or whatever. So the first thing I'm going to say is compression socks. And I have 3 here that I've not used yet, because I have used ones. They're in the dirty clothes. But first of all, that would be, I use these same ones, okay? I have 6 pairs, and so far I have been using the first 3 over and over, because I've worked 3 shifts a week. But then this way is nice, because if I pick up shifts, I still have them. So they came in 3 colors. I ordered these off Amazon. I think it was $16 for 6 pairs, which is nice, because the price tag on these says each pair is worth $5. I don't know if you guys can see that. But I bought these. And they're nice. They come in this like dark charcoal gray. There's a white pair, and then there's a black pair. And there was 2 of each of these. So have been using these, and at first, even through nursing school, like they kept saying, you'll want to invest in compression socks, and I kind of thought, yeah, okay, like whatever. And even thought that at the beginning, but after working 3 weeks on the floor, my feet hurt so bad, and I was like, I have to do something. Like, I already bought new shoes, and I had like the gel inserts that I put in the heels, and my feet still hurt so bad. So I bought some compression socks and decided to suck it up. Also because maybe it'll save my legs in the future. My veins in my legs and stuff. But I saw such a difference even by the first night. I wore these, put them on, put my shoes on, and my feet hurt throughout the night, but I definitely felt like ready on my feet, like ready to go kind of thing. So I do recommend compression socks for nursing. You're standing up a lot. It is bad for your legs, so it'll just kind of save you in the long run if you have compression socks. Save yourself the health, trust me. And the next thing on my list is gum. I recommend having gum. And now that I actually picked this up, I realize that I need to get some more. I use the Mentos gum, but for me personally, I don't have a toothbrush there. But the gum helps for night shift work. When you're done with lunch, freshen up your breath, some kind of mint. But also, on the off chance that it's a night that we're not super busy and that I do have some downtime, I'm able to just pop one in my mouth, and it helps keep me awake, keeps me focused. But then I also try and find things around the unit that I can do to help the unit, whether it's filing papers or something like that for the charge nurse. Walking around, checking on all the patients, making sure that the techs don't need anything. Take care of your techs. You'll learn to love them, and they will love you. So I recommend gum. This is sugar-free gum just because I'm trying to eat healthier and watch what I'm eating and exercising more. So I use this gum. Definitely recommend having gum, something to chew on, whatever. The next thing on my list I have is soda, and I just have this to like symbolize soda. I bought this. I know I did not buy this. I got this for Christmas. This Christmas or birthday present, I don't remember. But from my aunt and uncle, it's a Yeti mug. And I will put ice in this and then put water or something in it, something flavored, like flavored water in it to drink throughout the night. But usually about 1 o'clock, 2 o'clock, if I'm caught up on everything and I'm just sitting there charting, I don't necessarily want to stand because I want to save my feet, so I sit down and chart, but then I sometimes, like second or third night, get super tired and just want to sleep. So I sometimes will keep in my locker a can of soda or bring it in that night if I know I don't have one in there to have on standby. Something with caffeine. It doesn't have to be soda. Something with caffeine. Coffee. Sometimes coffee makes me too hot though, so then I'm like, oh, you know. And coffee also makes me have to pee, which you don't always get time to pee for. So just something with caffeine, something to keep you up, something to like boost your energy or whatever it is. I recommend that. To go along with that, I don't have something here to like show for it. But snacks are really good. You know, you can pack healthy snacks, carrots and ranch or you know, Cheez-Its or fruit. I pack grapes sometimes for a snack and will like eat that while I'm either charting or when I have time I'll go, you know, eat my snack. Yogurt, something like that, something that you can just like, if you are having problems falling asleep, you can eat, but also working night shift, especially if you're going from like night to day shift, night shift, like it just helps keep you awake, keep you alert, keep your brain running so that you can function, because that is very important. Another thing I don't have here with me right now is a jacket. Some kind of jacket that you can wear because it gets frigid at night. Like, it is so cold, especially, there's like, this was probably designed on purpose, but there's 3 computers that we can sit down at to chart right in the main nurses station, and each one is under an air vent, and I swear the air never turns off at night. Like, in what? Period. I mean, it never turns off. So it is blowing on you, and I swear you could see snowflakes coming from the air conditioning unit. It is so cold. So I recommend having a jacket. Mine has pockets. It's in the wash right now. But mine has pockets, so that's really nice because then I can utilize those pockets and I'm not trying to shove everything in my scrub top and then I'm like overloaded and weighted down and it's a mess. The next thing on my list that I would say is a must-have is Germ-X. I keep one of these. I actually have it here on my lunchbox. It's just sitting here waiting to be packed. But I have this one here that I keep on my lunchbox, and it's just like attached, and I actually need to change it probably after this week. But I use that because you're in nursing. You're doing disgusting stuff throughout your shift. When you go to eat, like, I want to have clean hands. So I usually will wash my hands at the sink there in the break room, and then I'll go and use Germ-X in addition to that, just because I feel disgusting some days. And when you think back on what you did, it's like, ugh, okay. But then I also carry this, and this has 2 purposes. So not only do I have this, sorry, there was a bug. I have Germ-X, but another thing is lotion. And not only Germ-X to keep my hands clean, but the lotion helps to moisturize because, you know, hospital, you use the hospital Germ-X, but after a while, my hands in particular, and it's cold, they get dried out super easily, and it just gets kind of gross and disturbing. So I keep lotion in my locker to just go and use. It's better than the hospital lotion, which I don't like. It's like really watery. So I use this, but I also have another use for these, and I learned this in nursing school, is if you know you're going into a patient's room, maybe they have an ostomy that smells disgusting, or Sometimes I've had to do, because I work on an oncology unit, I have cancer patients who maybe just went for dialysis. They're nauseous, they're throwing up. That is one of the things that bothers me. It sometimes can get me to gag. So what I do is I just go in and I say, this mask is for to keep you safe as well as myself. And I will put a little bit, also the mask hides the smell from them, but I'll put a little bit of lotion or Germ-X, whatever I have right on hand. Sometimes the lotion's in my locker and I can't get to that because it's like an immediate thing. So I'll get some of this, I'll rub it on my hands and then rub it under my nose here on my upper lip, and then put the mask on. So then I'm smelling that. One, if I'm changing an ostomy, I don't have to smell it. It not getting to me, and I can focus on the task rather than like holding my breath trying to do the task or whatever. But then it's also better for the patient, because when I have that mask on and I have lotion or Germ-X on, I'm able to talk to the patient while I'm doing the procedure. Even if it's a comatose patient, you don't know if they can or cannot hear you. So it allows me to talk to the patient, tell them what I'm doing, converse with them, and I'm not sitting there holding my breath trying to be disgusting and rude while still saving myself. So, little tip and trick of the trade. Lotion and Germ-X, also because I just feel so disgusting that I'll like use the hospital Germ-X and feel like it did nothing, and I'll wash my hands or whatever, and I don't know if it's the smell of these things or what it is, but this one is Black Cherry Merlot. It smells so good. I also have hand soap at home here for this. It smells so good. I don't even know. It smells like cherries, which makes sense because it's cherries. So anyhow, those two are things I would recommend. The next thing I would recommend would be pens and pencils. And I have pens here. And this is kind of a twofold answer. But I have pens and pencils. I have pencils, which aren't these super cute? My boyfriend got them. They're like, I think my boyfriend got them. I don't know where these came from. They're old though, but these are like Valentine's heart ones. Maybe these were the ones. These might have been the ones I bought at Walmart. But anyhow, these are Valentine's Day love heart pencils, whatever. They were cheap. They aren't like super expensive. So I bought some of these because there's certain forms that we have to fill out for like change of shift when we're handing off report to our day nurses, that we have to write in pencil. So there's a sharpener there. These are not sharpened, but I just use these because if I lose it somewhere or someone steals it, it's no big deal. I can pick up another pack at the dollar store or something. Next are pens. Must have. I have 3 pens here. This is actually, and I mean I have more than this in my bag, but these are just what I have right now, because what I do is when I get off, I have like my essentials that I put in my pockets, and after each shift, like I put them in this bag and Ziploc them together so that they're all together. After I've cleaned them, I like to sterilize things. But after I've cleaned them, I like put them in the bag for my next shift, and then I just pull that bag out and put my stuff in my pockets and I go. So once these die, like I have other pens that I use, but I also keep them in my bag, and I keep one on me so that I remember to either grab it back from the doctor when he takes it from my hand because he needs a pen, or if like I let somebody borrow it, I remember to like, hey, I need that back. But I also have backups in case these die or whatever. So I have one black pen, and what I usually do is as I'm getting report, making notes, doing my assessment, my initial things, I write it down on my paper in black ink. And then let's say like pain med, I give a pain med and I need to reassess them. Something in their care changes. Something that maybe I want to make sure I tell the next nurse. I write it in red ink because it just catches my eye on the paper, and I can go through each one. So say I'm getting 3 shifts from a nurse, and I know she's coming back in the morning. Most likely she'll have the same patients. So if she just wants an update, like, you know, what's new with them, I can look for the stuff that I've written down in red. Like, okay, I gave their last pain med at 2:13, which also reminds me that at 3:13 or 2 whatever, I need to do that pain reassessment. Or I can say, oh, you know, the trach was taken out, or not trach, the NG tube was taken out, the trach was changed at this time, their wound was changed, whatever it is, I write it in red. If it's something that I need to pass on, I need to chart, I need to like be aware of, I write it in red. And then I have this permanent marker I use to write on bags, I use to write on patients' form, like different things. You'll find it comes in handy. And then the last one I have is this dry erase markers. I bought a set of dry erase markers, and some hospitals stock them for you, but we have these boards that are communication boards in each patient's room, and it basically, you write the date on it. I'll write my name, my number, and like on the side, like I write, there's like a square, big square there, and I write their care plan. So what we're going to be doing for them that night. Controlling pain. That's a huge one on our oncology floor. Getting ready to administer blood. Getting things in order for discharge the next day. Stuff like that. So I just make little notes on their whiteboard. So I use this and carry it around with me for the beginning of shift in particular. So I highly recommend some kind of utensil to write with or whatever. Also recommend a water bottle of some kind to stay hydrated. I have like about 3 of these, I think, at Walmart, and they're really nice because you can unscrew them here at the top, so you can put like ice and stuff in them, and then you can rescrew it, and then this part comes off so you can drink out of it, because one of the nurses that I was orienting with, she's super sweet, we have this hydration station, and you can only keep your drinks at the hydration station. So all of our drinks are over there, and she's like, you know, that's kind of nasty. Like, you got straws or whatever. And that's where I just started using this, like, one-time use it, and then I put it in my lunchbox so that, because it's gross. She's like, you gotta, like, it's open, so who knows, like, what is touching there or whatever. She's like, ugh. And so she had a Coke bottle at the time, and as I sat there and I started thinking about it, I was like, that's true, that's disgusting, like, ew, you know, I want my mouthpiece at least closed off from others so that a hand or arm doesn't brush against it, because where has that hand or arm been? Again, I'm the germaphobe, I guess. So I bought like 3 of these at Walmart, and I want to say they were like $6, $7, $8, something like that, but they're insulated. It came with like an infuser ball. I have them around here somewhere. I think one's in the dishwasher. But you can put like fruit or lemon slices or something in there, and it floats around in the thing. And I'm thirsty. So I recommend something for water. Keeps you awake at night, especially. Something you might want to think about is something with a closed top. It's an option. It's up for you. The next thing I have is I keep it in this plastic sleeve, but just because it keeps it from getting other marks or whatever, is I carry this little calendar with me, and I know it's in the plastic that it came in, but again, like I said, I keep it in my bag, and then if my pen is open and it marks against it, it's not making marks all over the place. It's on this thing, which usually just wipes off with my alcohol wipes. So I just keep this because I can put down on my schedule what it's for, and then it's also nice for my parents, because once I get each shift, and this one's still on February. I need to flip it over and change it, but I've written it down until April, what I have. I don't use it frequently because I generally know the week before what my shift is, but it's nice for like my family. I'll take a picture and send it to them in our group message so that they can know what nights I'm working, to not call me during the day unless absolutely need be, because I'm most likely sleeping if I can. So it also helps keep me organized. I'll take it out and I'll switch it. But like I said, this first March has been just crazy. So, and then I'll just, like, as the schedule comes out, I'll write it down so that I also know when I need to plan, like, doctor's appointments or whatever the case may be. So, I would recommend having a calendar. It doesn't have to be this kind. It could be a notebook where you write down, like, the days of the week yourself that you're working or whatever. Some way to keep track of your schedule so that you're not missing a shift, so you're not missing work. But I think that covers like my top 10 like favorite or things that I think you must have working night shift. But they're not necessarily just night shift. They're any shift. Just the one main thing is caffeine at night. Or if you're trying to be healthier, which I'm trying to be, is healthy snacks, apple slices, carrots, celery, and peanut butter, stuff like that you can eat that keeps your brain and yourself awake as you're working the night shift. So I hope you guys liked it. If you have any questions, feel free to ask. Please thumbs up, like, subscribe. Let me know if there's any other video topics that you'd be interested in, any video topics you want me to cover, any questions you have. Maybe if I get enough questions, I'll do like a video question response thing or whatever. So you can follow me on Instagram. My Instagram's linked to this account, and I will put in the bottom description a link to that other video that I did for nursing school, for those of you who are still in nursing school, the things that I thought might be essentials. But I hope you like this video, and I will see you probably in a couple days when I do my update after the next 4 days that I'm working. And let me know what you think. Hope you guys have a great day. Thanks for watching.